Welcome to the Spinning Babies Childbirth Preparation class for parents. We're going to talk today about physiological birth and comfort in pregnancy. Physiological birth is a birth as nature intended, with the mother's own powers starting the labor on its own and fulfilling the labor on its own spontaneously. All right, let's go through the class together and introduce ourselves, saying which baby this is and what brings you to the class.
My name is Joanne Youngsma. This is my third baby, and I'm here partly to find a little more comfort during pregnancy.
And I'm Amber, and I'm her doula.
My name is Lauren, and this is my husband, Ryan. This is our first baby, and we're here because she's persistently breech.
Hi, my name is Sarah, and this is Brian, and this is my first and Brian's third. And we're here because I want to get as much knowledge as I can about how my baby and I can work together when we're birthing, and how my husband can be a support to that.
My name is Laura, and this is
Carlos.
my boyfriend. And it's our first kid, and we're here to learn more about pregnancy.
My name's Michelle. This is my husband, Steve, and we're just here to gain more knowledge and just to make it easier during the birthing process.
My name's Ayana.
And I am Paul, and we're here to gain more background knowledge about birthing.
Many of you are expecting your first babies or to have a simpler, easier birth. And I think that the premise for that is that fetal positioning matters. A lot of times when we think about the birth that we're going to have, we have intentions and we have an ideal of what we're expecting to have happen. And for many of us, for many women giving birth, those ideals can come true with support and preparation. In fact, if we think about all women birthing, and we have this magic bell curve here, most of the time there's some work involved, which is why we call it labor and not vacation. That some women are going to have an easy time, and some women are going to need some more help. Maybe they need some help of their doula, their midwife or doctor, and even a few women are going to need to have a cesarean, even though they plan to have a natural physiological birth. And many women can have a physiological birth simply because we're designed for birth. Our birthing bodies have the hormones and the structures to open up and have our baby. But our society isn't really designed to support birth. We sit a lot today, we drive a lot. We have, here I am leaning on my right foot. We favor one side of the body, how we carry things, how we cross our legs. And this makes some changes in our bodies that our babies need to navigate. So spinning babies is about the baby's role in birth. As a doula for over 30 years and a midwife for over 20 years, of course, I'm very interested in helping women have a more comfortable pregnancy and a more comfortable birth. I would help women that would have the best intentions and good preparations, and sometimes it wasn't enough. The labor might have gone a couple of days. She might have had some back labor, which is feeling most of the contractions in the back instead of where she expects to find it. Or there'd be just things that she didn't expect, which is hard on the morale. And as I watched that, I found that the baby's position mattered, that the angle of the baby's head in the pelvis really played a strong role in the process and the progress of the birth. And as I was on a quest to learn more about that, I found the book of midwife Jean Sutton and childbirth educator Pauline Scott from New Zealand, Optimal Fetal Positioning. And Jean sets it out on how fetal positioning influences the birth. This helped many more of the women that I was helping as a doula and midwife move from a more difficult birth, and sometimes just before a cesarean, using these techniques over to the easier side of labor. But it still wasn't helping every woman. So I had this question, why not? This was helping more women, but not every woman. And then I found the work of Dr. Carol Phillips, who brought in dynamic body balancing, how the mother's body has tension or looseness, and if we can balance that out, bring it into alignment, and help it be more flexible, mobile, and symmetrical in the tensions and the loosenesses of the muscles, ligaments, and joints, the baby can navigate the location of the womb and the pelvis much better. You know, so much attention is on the mother's dilation. How far along is she dilated? We don't remember that 50% of the work is done by the baby. So the way the baby is coming into the pelvis helps the labor. It's mom's job to dilate, but it's baby's job to rotate. So what we're going to talk about today is how can we help the baby? Let's make more room for the baby so the baby has an easier time